Today's topic is intravascular contrast media for CT scan, MRI, and ultrasound. Now that most of the contrast media is excreted within 24 hours of injecting it. Now the types of contrast media are the ones which are used for CT scan, the ones which are used for MRI, and the ones which are used for ultrasound. The ones which are used for CT scan are iodine based or non-iodine based. The non-iodine based are the ones like barium, in which the barium sulfate is made to, or a patient is made to take barium sulfate orally in the concentration of 1 gram per milliliter of the water, and generally the reactions, the side effects of barium ingestion are basically constipation, aggravation of ulcerative colitis or peritonitis, and causing of peritonitis if there is a leakage and spillage into the peritoneum. The other type of contrast media are the iodine-based contrast media, which are divided into the low osmolar ionic contrast media, low osmolar non-ionic contrast media, high osmolar ionic contrast media, and isoosmolar non-ionic contrast media. Coming to the high osmolar ionic contrast media, these are generally not used nowadays, and the only ones were the ones which had sodium salts and meglumine salts with it, and like N-methyl glucamine, and the low osmolar ionic contrast media, the only one which is used nowadays is ioxaglate, and then comes the low osmolar non-ionic contrast media, and which is the commoner ones which are used nowadays, like iohexol, ioversol, iopromate, iopamide. And then comes the isoosmolar contrast media, which are the current trend in radiology, which are the commonest one are isomenol and iodiazonol. Then now the contrast media for MRI is generally technetium-99, gadolinium, diethylene triamine, penta-acetic acid, and now gadolinium can also be used in X-rays, as it can give a contrast reaction, but generally it is not used. But if a patient has allergic reaction to iodine-based media, then definitely gadolinium-based contrast media can be given. Now the other ones for USG are the ones which USG contrast media, the ones which have microbubbles. Now the microbubbles are of three types. One is basically air surrounded by galactose, and another is basically octafluorine surrounded by albumin shell, and the third type is sulfur hexafluoride, which is surrounded by a phospholipid shell. Now the microbubbles are intravascular contrast agents, which are seen on the ultrasound. A special ultrasound software is required, though a normal ultrasound can also help you show the images, but the special software helps you to subtract the background images, background tissues, and show you only the contrast-based reaction, contrast highlighted portions. Now the types of adverse side effect reactions can be acute, late, or very late. Acute means the ones which occur within 1 hour. Late are the ones which occur between 1 hour to 7 days, and very late are the ones which occur beyond 7 days. Now the acute reactions can be either your idiosyncratic, or which is basically non-dose related pseudo-allergic reactions, which occur either due to release of the histamine or due to release of bradykinin or kinin from or which basically of disturbance in the immunoglobulins of the or it can be due to anxiety or fear. Now the other reactions are, apart from idiosyncratic, are the Chemo Toxic, which is basically damage to the cells and leading to edema, and the third type is vasomotor, which is basically hypotension, tachycardia or bradycardia, and systemic even shock or cardiac arrest. Now based the other types of other The other type of dividing it is basically renal and non-renal. Renal can cause decrease in GFR. Non-renal are the reactions which occur in other parts of the body, like in the skin, erythema, epilation, and also there are very late reactions. The very late reaction basically are like thyrotoxicosis. The normal amount of thyroid iodine in the body is 0.01 gram per day, and so if that is increased, that can cause thyrotoxicosis. And also there can be nephrogenic systemic fibrosis, basically, which is fibrosis on the entire body, which can cause contractures in the wrist, the arms, the legs, and can also affect the heart, the kidneys, the lungs, and the liver, and cause massive fibrosis. Now also our reactions can be defined on the basis of mild, moderate, and severe. Mild is basically just nausea, just a mild amount of vomiting, a little dizziness, and moderate reaction is severe vomiting and bronchospasm, breathlessness, and edema and swelling over the entire body. And very severe are basically cardiac arrest or seizures and cerebral arrest. These are the causes. These are the types of very severe or severe reactions. And the management is basically maintain airways, give oxygen, and give 1:1000 adrenaline in about 0.1 to 0.3 ml and 0.3 to 0.6 ml of atropine intramuscularly, of course. And the contraindications to contrast media. What are the contraindications? The contraindications, contrast media is contraindicated when there is a renal, either a contrast related or patient related. Patient related is basically a previous history of contrast reaction, history of asthma, or if there is a renal failure or there is pregnancy. And contrast related is the contrast are basically very known to be very toxic, like high osmolar contrast media, then they are contraindicated. Well, please like and subscribe to my channel for further videos on diagnosis. Thank you.